In the emergency department, we provide leadership, promote patient safety, work on diagnostic accuracy, perform life-saving procedures. We work on efficient flow, accurate disposition while combating COVID-19. This is an astounding juggling act. Conflict enters our workspace every shift. It disrupts patient care. It adds stress, contributes to burnout, and shortens our careers. It can escalate to violence, and in fact, injuries are 4 times more common in healthcare than in private industry. How do we learn to manage conflict? Well, all conflict is not the same. We can't speak in generalizations, whereas specific cases can highlight the continuum of increasing risk, from polite disagreement to raised voices to verbal and even physical aggression. How do we teach conflict de-escalation to residents? We can start with a PowerPoint presentation. We can teach about communication, describe what a de-escalating tone sounds like, what are de-escalating body cues, what are lousy word choices that we should really avoid. Will this put our residents to sleep? At the Pediatric Emergency Medicine Fellows Conference, we said yes. We need to do more than PowerPoint slides, so we opted for demonstration with role play. 2 physicians were actors. One played a doctor, one a parent. Take 1. Everything went wrong and there was escalation. We stopped and we reviewed. This template, describe, demonstrate, and review, we did over and over again. Take 1 with escalation and review. Take 2, incorporating new techniques, and effective de-escalation resulted. And we reviewed again. Take 1 sounded like this. My daughter's in pain. No one's doing anything. Hi, I'm the doctor. We're doing something. She got an IV. I checked her x-ray. I called an orthopedic surgeon. We've been here an hour. Actually, ma'am, it's only been 45 minutes, and she's been in pain for over an hour. Look, you need to calm down. Let's stop and review. Some bad choices, Dr. Savvy? You bet. Our learners heard the scolding defensive tone, the arguing, the bad word choice. They saw that pointing finger. We asked them, how do you feel? How do you feel when you see that conflict? Well, most of them hated the conflict. They were uncomfortable, kind of squirming in their seats and inching away a little bit. They were actually pretty relieved when it stopped. So we asked them, how can we improve it? How can we work on tone, body language, and word choice? And they gave great responses. We organized those responses in take the heat, hearing the caretaker out, empathizing, apologizing, and taking action. Take 2 went better. The doctor's side sounded like this. Are you Mrs. Smith, Aaron's mother? I'm so sorry I didn't meet you earlier. I checked Erin immediately. We're getting her pain medication for her fracture, and I've contacted orthopedic surgery. I apologize for the delay. Let's go talk to her and get her pain under control. Some better choices, Dr. Savvy? You bet. Our learners heard the empathy, the understanding, the calm tone. Their response to this interaction was relief. They were grateful to see it play out the right way, because de-escalation feels good. How about another demonstration? Male or female? The disruptive colleague. Your choice. I'm here. Where's the nurse for room 5? Taking a break? Perfect. You're nonstop paging me and I show up. Now there's no one around? Come on. I don't have time for this. Sorry, Dr. Disruptive. I have to stop you right now. We're in the middle of the ER and we need to talk privately. Dr. Savvy, will you join us in room 10, please? I get that you're angry. But if you're frustrated, you can just talk to me. We have a lot of sick kids and worried parents who need a calm environment. I need you to respect that in the ER. And I'll respect your workspace as well. Now, how can I help you take care of our patient? Let's stop and review. What did Dr. Social Skills do? Our learners heard it. She shut it down. She moved this conflict to a private space, and she recruited support. But she did more than that. She engaged with empathy. I get that you're angry. She returned the focus to the patient. She established boundaries. She set expectations for professional conduct. And she modeled the desired behavior by using a calm tone and voice. Role play to demonstrate conflict keeps your learners alert and engaged. Attuned to body language, word choice, and tone of voice, they can witness failure as well as effective de-escalation. They can do more. They can get pulled on stage as a savvy doctor, and that trainee can contend with a conflict, practicing techniques in a safe environment. As attending physicians, we confront conflict in the ED every shift, and our trainees are watching us like hawks. They're learning to model compassionate, professional, and effective behaviors. Role play with interactive demonstration may produce trainees to squirm a little, but they learn and grow. And while clinical decision-making is based on evidence that will likely be obsolete in a number of years, effective de-escalation strategies will serve our trainees the rest of their careers. Thank you.